Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will talk to Heather Reardon, Director of Professional Services with Brunswick Novant Medical Center, about the new MyChart system. We will also chat with Fran Salone-Pelletier, the lead volunteer chaplain at Brunswick Novant Medical Center. Our last guest today will be Sarah Barnwell of North Carolina Cooperative Extension on the Eat Smart, Move More, and Weigh Less program. Stay tuned to learn about valuable health topics with Health Watch. Our first guest today is Heather Reardon of Novant Health. Welcome to the show today, Heather. It's such a pleasure to have you.
Thank you for having me.
You're welcome. Now, how long have you been with Brunswick Novant Medical Center, and what exactly is your role there?
I've been here about 4.5 years, and I am the Director of Professional and Support Services. And so I oversee the radiology department, the laboratory, and then I also have oversight for all of the outpatient physician clinics in the area.
Wow, that sounds like a big job.
It is at times.
Well, I'm curious, what brought you to Brunswick County?
My husband and I were looking for a change in lifestyle and, more importantly, warm weather.
Wow, and you found it here.
I sure did.
Well, let's begin today by talking a little bit about your education and then your background.
Great. Yeah, I have a Bachelor's of Science in Healthcare Management, and I have a pretty diverse background. I have been employed at both large facilities in the Boston area, as well as outpatient imaging centers and physician clinics.
Wow. And you mentioned you work with the Novant Medical Group practices in the area. Who are those practices?
We have several. We have Calabash Internal Medicine, which is in Calabash. We have Oceanside Family Medicine and Convenient Care, which is in Charlotte. In addition to those, we have several specialty clinics. We have Brunswick Pulmonary and Internal Medicine in Charlotte, Brunswick Urology Partners, which is also in Charlotte, and then we also have Brunswick Surgical Associates and Brunswick Women's Center, which recently moved into the new medical office building on the hospital campus.
Yes, I heard that, and I think they recently had an open house.
They did. It was a great turnout.
Well, today we wanted to focus on a new service that Novant Medical Group is offering called MyChart. And can you tell me a little bit about that? Just give me an overview of what that looks like.
Sure, I'd be happy to. When we began utilizing our electronic health record, which is Epic, our Dimensions project also has the ability to allow patients access to their electronic records, and the application is called MyChart.
Well, I'm curious, what can patients do in MyChart?
There's a whole host of things that patients can do, some of which are they can communicate directly with their care team via email. They are able to...
Including the physician?
That is correct, yes. Access to the nurses as well as the providers. And they can also view lab results and test results that have been ordered by their physician. And in some functionalities, they can do online scheduling.
So they can go in and schedule their own appointment for some practices?
They can, yes.
And so if they had some outpatient testing done, whether it be labs or imaging studies, once those results are available, they would be able to visualize those in their MyChart?
That is correct, yep.
That would be a huge bonus to me, I would think, waiting on that phone call. And
yeah, I'm a patient and I have access to the application, and it has been a huge benefit. So I can do it on my scheduling, whether it's in the evening or on weekends. And it also provides you with all of the reference ranges for any lab results that you have done, so you're able to cross-check versus previous testing in other facilities.
So Heather, can you give me an example of how a patient might utilize MyChart to make their life a little easier?
Absolutely. A great example would be if your child became sick in the middle of the night, had a fever, you had some questions, you were a little concerned. You could go online to your physician's, to your portal for MyChart and look at availability, and you might be able to schedule that 8 a.m. appointment to which you could go in and see your provider. They'll be able to see your child and then send a prescription to the pharmacy, all online through an e-prescribe. And you could then leave your physician's office, go to the pharmacy to have that prescription ready, which all changes the way that you treat your child. Whereas before electronic records, if your child was sick in the middle of the night, you would have to wait until first thing in the morning. Right. You'd have to try to call the office and hope that someone could answer and expedite the appointment for you. And this way, if you just have a simple question, you can email that provider as well. So maybe you don't feel as if it's that critical that you be seen. You can ask the question and then wait for a response. And or if you feel like it's urgent that you be seen, or a child or a loved one, then you can just go ahead and schedule that appointment online.
Well, in that scenario with the prescription, that would cut down on the wait time. I assume that when the patient arrives at the pharmacy, it's likely that the prescription would already be ready, and so your child is on its way to recovery much quicker.
That is correct.
Yeah,
yes.
That does make life easier for a mom or a father who's dealing with a sick child. So let me ask you this. If you had a rash or something like that, would you be able to communicate with the physician about that rash or that wart or whatever you're visualizing on your face?
You sure can. There's a function in my chart to where you can take a picture and upload that picture through the portal to the physician and send the question whether or not you think it's something urgent, and the provider can then review that picture and determine what your next steps are.
That's really techy.
Very cool. Very cool function.
And you said that labs and other tests results are also available in my chart.
Yep. The history of lab results that were done at that practice are loaded into my chart, and so you're able to have a comparison, month over month, if that's how frequent you have your labs, or to be able to go back and see if you're making progress, or perhaps you have areas that you need to work on. But that all remains within your My Chart portal.
So you can see your cholesterol results from several months back, if they're provided you've had those tests done, and see how you're doing, whether you're going up or down, right?
And another great feature to that is it's available on your mobile devices.
It is?
It sure is, yep. And so if you have an appointment with a specialist, perhaps that is not on the Epic system or part of the Novant Medical Group, you could have access to your record in the office to share lab results if there is ever any questions.
Wow, that's a real plus. Currently, I know physicians typically call your home and leave messages on your voicemail, and you're asked questions like, is it okay to leave the message or give it to your spouse or significant other? How about in My Chart? Can you do something like that?
You sure can, yep. You just need to work with the provider in the office and make sure that you have the proper authorizations in place and proxies in order to be able to view spouses or children, other health information.
And you can have access to your child's records also, but I assume that after a certain age, it's probably
that is correct.
Changes.
Yeah. And even with it being the child, you still have to fill out, the proper authorizations for the, the minor proxy.
Now, My Charts is web-based, is that correct?
That is correct.
So you access it through the internet. And I'm curious about safety and confidentiality of that. Can we talk about that a little bit?
Sure. We use industry standards in terms of all of our security measures, and so the application itself is secure. However, you always want to be careful to make sure you don't leave yourself logged in somewhere, or you have multiple browsers open at the same time to make sure caches aren't floating between programs. So as long as you properly use it, then the application is secure.
How many of the Novant Medical Group practices are utilizing My Chart?
Currently, we have 3, and they are all part of one larger medical building, and that is Oceanside Family Medicine and Convenient Care, Brunswick Urology Partners, and Brunswick Pulmonary and Internal Medicine.
Will other practices be joining soon or in the near future?
They sure will. We're in a system-wide rollout phase, and we hope to have all the remaining clinics here in this market up by end of year 2013.
Wow, great. Well, before we close, is there anything else you would like to add about My Chart or about Brunswick Novant Medical Group?
Sure. I just want to say that Brunswick Medical Group, as well as all of the systems, are all patient-focused and quality-driven. We aim to provide the safest care possible, and my chart is just one application to help patients have convenient access to their health information.
Good information, Heather. Thank you so much for coming today. It's been a pleasure having you, and hope to see you soon.
Thank you so much.
Our second guest is Fran Salone-Pelletier, the lead volunteer chaplain at Brunswick Novant Medical Center. Well, welcome to the show today, Fran. It's such a pleasure to have you.
And it's a pleasure to be with you, as
Thank
it always
you.
is, June.
Thank you. Well, tell us a little bit about yourself, Fran.
Well, I am a wife, a mother, a grandmother of 4, and a professional religious educator for almost 40 years.
Wow.
In fact, I think a little bit more than 40 years as I count them back.
Wow, that's great. Well, we're here today to talk about the chaplaincy program at Brunswick Novant Medical Center. Could you tell us a little bit about that program, Fran?
The program has been in existence for as long as the hospital has been in existence, but it's
Really?
come a long way. It's come from being a program where local clergy sort of came and visited patients at will and did a good job. However, as the time has gone by, years have gone by, we have become much more professional, and it is not local clergy. There are folks who are dedicated to being chaplains as their ministry, and they come to us either with previous experience, or if not with the previous experience in education, they go through an educational process before becoming chaplains. As the chaplaincy program, I guess people sometimes think that chaplains are local clergy, and in large part they are, in the sense that they do have churches here, but the program is specific to the needs of hospital patients and not to a general congregation.
Oh, I see. Are you yourself one of the chaplains at the facility?
Yes, I am the lead chaplain, have been for a number of years, and very happily so. And I'm also the administrative liaison from the chaplaincy program to the staff I call it staff, it's a general term I use, all of those who are in charge at the hospital.
Why were you interested in becoming a chaplain, Fran?
Well, most interestingly, I wasn't interested. My husband, being my husband, decided that this was something that I needed to do to broaden my spiritual experience and deepen my own spirituality. And I was terrified. I had not done that kind of work, and I was not very certain that I would enjoy it. But his impelling force in my life was such that I decided I would give it a go, and I love it.
Knowing your husband as I do, I can fully understand that he would do something like that
Right.
to you, but he was right. He was right to do that. And I understand that you're the lead chaplain, so what all does that entail?
Well, generally speaking, I facilitate our monthly meetings. As I said earlier, I'm the contact between the chaplaincy program, all the
And
chaplains,
administration.
and administration. I also represent the chaplains at some of the major functions of Brunswick Novant Medical Center, and try with all the other chaplains. I must say, I don't do this as a lone
You don't do it
ranger.
alone.
Try to find additional folks to join us in the program.
Speaking of that, how many chaplains are there currently in the program?
We currently have 15 chaplains, 5 of whom have chosen, instead of taking on-call weeks, they've chosen to be what I have kind of loosely termed day chaplains, in that we have coverage Monday, Tuesday, Wednesday, and Thursday in lieu of their taking an on-call week. And the chaplain on call does all the emergencies for that time period, but doesn't have to do rounds.
So that's quite a bit of coverage.
Absolutely.
It's always-
We do offer 24/7.
Really?
Yes.
What might be the appropriate time to call a chaplain? I mean, when does someone call a chaplain?
A chaplain can be called anytime a patient or a staff member or a member of patient's family decides that they would really like to have a listening ear. That would be, I would say, our primary function, that we are active listeners. We, again, unlike local clergy, we are not there in any way to evangelize or proselytize. We are simply there to be that presence, that spiritual presence, which statistics have found has been absolutely essential in the healing process.
Can you give us an example of a type of situation where volunteers typically get called in for?
Well, we would get called on any emergency. We get called if someone is in close to dying. In fact, we would hope that the family would give us a call a little bit sooner rather than a little bit later, because the chaplains, because we are all volunteers and we all live at distances, there is a time frame for our being able to get to the hospital. So those kinds of emergencies, if a patient just wants to talk, if a patient is afraid, previous to surgery, post-surgery, you know, any time where there is a sense of discomfort, a sense that a patient wishes to just talk to someone and doesn't want to be necessarily talking to a doctor or a nurse.
Sure. Yeah. If I'm in the hospital and I want those services, how do I go about getting those services of a chaplain?
Any of the nurses could contact us. We carry a pager. The on-call chaplain has a pager, and I have a separate pager because I'm like the backup for all the chaplains. In the event that the on-call chaplain cannot make it, then I'm called. So because we have a pager, any member of the staff can contact us on via the pager, or the women who work and men who work at the reception desk. They also can contact. In fact, we kind of clock in with them in the sense that we're there at the hospital so that they know we're on site. And they also know, obviously, if we're not on site, and they're able to call us.
And would that same process be used for during the night, anytime during the night? Is that the same process?
Yes. We've been called, I can recall a couple of times, 2 o'clock, 3 o'clock in the morning, where someone really is in need of a chaplain. Usually those are cases where there's a death, an imminent death.
Oh, I see.
And we also have gotten called on some very serious accidents, the great fire that occurred at Ocean Isle Beach, any of those kinds of times. We try our best, and so far, given the fact that we're all volunteers, I think we've done a marvelous job.
It sounds like it. It sure does. Now, I know that there's a chapel in the hospital. Tell me a little bit about that chapel.
The chapel is a real meditation room. It is so designated. There is a space for private prayer. There's a space for congregational prayer. One can just sit there and be quiet and be in the presence of God by whatever name one calls God. There's also a prayer book, or I guess I won't call it a prayer book, more like a journal, where patients,
you can write in it?
You can write in it, and
that's great.
And that has been greatly used. And all the chaplains who do rounds check that book when they come into the hospital, and they pray for all of those people in a particular way and indicate so on the book.
Oh, that's wonderful, Fran. Sounds like a great program.
I hope so.
Well, before we close, is there anything else that you'd like to share with our viewers out there?
Yes, I think I'd like to ask if there is anyone who's interested in this ministry and who would really like to make that kind of commitment. It does require a commitment. We do meet monthly, 10 months out of the year, and we do take on-call weeks, and those weeks are, depending on the number of chaplains at the present moment, there's 1 week for each quarter at least, so that all the coverage is there.
And there is training involved,
There is training involved, and at present we represent about 6 denominations, so those who are of other than the 6 that we presently represent will be most welcome.
And if anyone out there is interested, how might they make that contact? Should they just call the main number at the hospital?
Call the main number at the hospital, and they will contact me.
I see.
And I will contact my husband, who is in charge of education.
Well, thank you so much for being here today, Fran. It's been a pleasure to get to know you, and it sounds like a great program.
Well, thank you, and I am so glad that you asked me to come.
You're welcome. Our final guest today is Sarah Barnwell, an FCS Extension agent with the North Carolina Cooperative Extension. Well, welcome to the show, Sarah. It's a pleasure to have you here.
Thank you so much for having me.
Great. Let's start by learning a little bit about your background and your education. Where did you go to school?
I went to Appalachian State University in Boone, so I love my time up there in the mountains.
Yeah, everybody does who goes there. They all say that.
Yes, yeah, it's a wonderful place. So I studied nutrition and health promotions there. So that's my big passion is nutrition and teaching and educating people about nutrition and exercise.
Well, good. I'm anxious to hear about that today. Tell me a little bit about your role as the FCS Extension agent with the North Carolina Cooperative Extension and kind of what that entails.
Okay, well, FCS is Family and Consumer Sciences, so that's a very long title, but that covers different areas. I do programming in health, education, and economy for families. So those are our three big topics, and then I do programs in each of those areas for families for Brunswick County citizens. Cooperative Extension works with agriculture and with horticulture and anything that has to do with a family and their livelihoods. So that's what Cooperative Extension does, and I'm one piece of the puzzle.
Oh, I see. There are many pieces to that puzzle.
There are, yes.
Well, our main focus today for our interview is to have you talk about what I've heard called the Eat Smart, Move More, Weigh Less program.
Yes.
So let's talk a little bit about that. Give me a brief overview of what that program might look like.
Okay. Well, the Eat Smart, Move More is an initiative within North Carolina that different agencies have come together to provide. And so the Weigh Less, the Eat Smart, Move More, Weigh Less portion of that is the weight management or weight loss program. And so it's written by authors who get their information from land-grant universities. So it's evidence-based, it's scientific, it's not any sort of fad diet or personality type diet, but it's proven weight loss methods that work and that can help people lose weight and maintain their weight loss. So,
well, what makes this program different from the other diet programs out there? Is it mainly the evidence-based and the...
Yes, yeah. There's a lot of misinformation out there. People can Google something or look at a celebrity and see what they're doing, but those fad diets essentially don't work. They might work for the short term, but not for the long term. So this class will provide that information that helps people lose weight and stay at their healthy weight for their life.
Well, so if I signed up for the Eat Smart, Move More, Weigh Less program, what does that look like? How do I get started? What do we do?
All right. Well, the program, first of all, is 15 weeks. So that's a long time, but we'll start in January. The first day is Thursday, January 10th. We'll start at 5:30, and it's a 45-minute class. And then it'll last for 15 weeks, so one session each week for 15 weeks. And that class will cover different topics in the areas of healthy eating and active living, and also mindful living, so how to deal with stress. We'll talk about those ways too. So that we'll talk about details of those. Each session will have a different goal and details as a part of those 3 talking points.
So I think the stress piece is important because a lot of folks stress eat.
That's right.
It's the biggest stress reliever for
Yeah,
some folks.
that's true.
That's real important for everyone. So you said the classes start January 10th. And where will these classes be held?
They're going to be held at the Diana E. Gore Fitness and Aquatic Center.
Oh, great facility.
So it is. It's wonderful, and it's easily accessible
Right.
to the county. It's right there on BCC's campus.
And how might people sign up for the class?
Well, best solution is to call me at my office. We'll sign up. There is a registration fee, but that will be paid at the beginning of the class. And the registration is $40. So
Is that for 15 weeks?
that's for 15 weeks. Now, for people who come for the whole 15 week or 13 to 15 classes, we'll get a 50% refund.
Wow,
So
that's great.
I know. So it's a great incentive, and that makes it a great class for a good deal.
And how do they contact you,
You
Sarah?
can contact me by phone. It's 910-253-2610. That's our office number. Talk with me, and there'll be information on our website, the Cooperative Extension website as well.
What is the address for that website?
It's brunswick.ces.ncsu.edu.
Wow. Well, I think we'll have that on the bottom of the screen. So
Okay.
that's quite a long email address.
That's right.
And I'm curious, if you don't sign up for like the first class and you just heard about it, can you sign up in the interim there? Or do you need to sign up at the beginning?
We strongly encourage
Okay.
participants to come for the whole class. There'll be a journal that participants can keep, and it's also helpful if you have a buddy within the class that can help keep you accountable. That's one thing we'll talk about. So it is a structured program, and there'll be an evaluation for all 15 weeks at the end of the class as well.
How many participants will you take?
We will cap the class at 25.
Oh,
that's,
okay.
that's the maximum the classroom will hold. So we'll have 25 participants, and there'll be incentives, weekly incentives each week, and the Fitness and Aquatic Center is also going to provide some wonderful prizes for participants too.
Oh, well, that's nice. And will you be instructing some of
I
this?
will be. I'll have a co-instructor for a couple of the classes, but I'll be the main instructor.
Oh, that's awesome. I'm excited. I can't wait. Well, this program sounds like a great way to become a healthier person and to lose weight. Do you have any success stories that you'd like to share with us?
Sure. There's an average weight loss for this program throughout North Carolina between 9 and 10 pounds.
Wow.
Of lost, and so, but it's all really what you make of it. You know, you set your goals and you try to reach them. So that's a great amount of weight lost over those couple of months that the classes will be held.
Great. There may be some viewers out there who wouldn't be able to participate, but do you have any tips for them? You know, with the new year and everything and New Year's resolutions, what tips can you offer?
Sure, yeah. So this class is made during the New Year's resolution time, but for people who may not be able to come to this class, you can also think about a goal that you want to set. So New Year's resolutions can have a bad rap because people tend to fond off, the bandwagon and off their plans. So what you can do is make small goals. Maybe the first couple of weeks your goal is to increase water consumption, and you have a water bottle and you try to drink however many of those water bottles throughout the workday or during the day. And then maybe the next week you try your vegetables and you try to increase your vegetables and fruits. So make smaller goals, find a support system, find a friend or a coworker who wants to help you with that goal, and walk during your lunch breaks, all those things. Make smaller goals because you can reach those as opposed to a large one.
That makes a lot of sense, because when I try to diet, I say, no, I want to lose 10 pounds. I'm going to eat vegetables and fruits 5 times a day, and do all these things, and I fail at all of them.
Right,
So
yes.
that makes a lot of sense to set smaller goals. They're much more achievable.
Right, that's definitely it.
Well, that's wonderful information, Sarah. Is there anything else that you would like to share with our viewers today before we close?
Well, Cooperative Extension is here for people of Brunswick County, so if you have any questions or concerns, and we welcome questions and concerns and visitors. Our office is located at the Government Complex in Bolivia, so if there's any way that we can help you, or if you have suggestions for programs in any area, we welcome those.
So you're there for us.
We're there for you.
Great. Well, thanks so much for joining us today. It was a pleasure to talk with you.
Thank you. It's so nice to talk with you, too.
Thank you. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was helpful for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit brunswicknovant.org for more information on the hospital, local physicians, and general health information. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.